Get ready to get in the game. Stretch, strengthen, live, and thrive. You can be a winning athlete in the game of life. It's the Peel Appeal with author and corrective exercise specialist Matt Peel.
All right, welcome everyone. This is Matt Peel with the Peel Appeal podcast. How are you today? What's happening out there in your world? I hope it's a great day. It's a great day here at the Peel Appeal podcast for a topic I'm going to talk about with a good friend who I've interviewed before, more about the wellness end of things. A good friend, former coworker, great all-around dude. So we're going to welcome in today, Mr. Arden Ballard. How are you today, Arden?
It's a beautiful day, Matt. Good to see you, man.
It is a beautiful day somewhere.
Somewhere.
We get a lot of rain as we record this. We're getting a lot of rain in our neck of the woods. Maybe not specifically at this second, but overall, it's been a very wet year compared to last year.
Hey, as they say in Louisiana, man, if you don't like the weather, just wait 10 minutes.
Dude, I'm telling you, it's right on the dot. Right on the dot. So today, we're going to talk about something pretty exciting regarding a topic that's near and dear to everyone's heart, quite literally, and that's healthcare. You may love it, may not love it, because it's very complicated out there when we talk about things like insurance and going to see a doctor or going to see a specialist, or even which plans do I choose on my employer's list of choices. Is it the high deductible, the low deductible, the no deductible, the all those different things? I know I go through it once a year in open enrollment, but there's a whole new concept out there. Not really too new, but a little different that could help out that Oren's a part of now as a physician assistant. And that's a little bit called the direct primary care model. So give us a little intro into what that is.
So, Matt, it's no surprise, and you mentioned it a second ago, most people hate their insurance. Most people hate the insurance industry. That's the health insurance industry, especially. Right. Most people don't trust the medical community anymore, especially after that little virus thing that happened a couple of years ago. Most people have grown to just not trust the entire medical system. And so that means they don't schedule appointments, they prolong care, and they wait longer. They're hesitant to see providers as a whole. It just makes for a more unhealthy or more precarious health circumstance. So you mentioned direct primary care. Direct primary care is, in my opinion, the solution to the very bloated and complex medical system that we have in the United States. Because insurance sucks so much, people are looking for solutions to get the healthcare that they need and not spend an arm and a leg and have to choose between, putting food on the table and paying their health insurance. I'll start with saying what DPC or direct primary care is not. And we are not an insurance policy. But what we do is we help patients think differently about how to utilize insurance as a whole, right? So in my practice in particular, it's called Integrated Concierge. We are a membership-based primary care and urgent care network. And I say network because we have multiple locations and we're expanding all the time. What you do at a direct primary care clinic is you pay a flat monthly fee, a very affordable rate that enables you unlimited visits with your provider. No deductibles, no copays, no claims against an insurance. It's very upfront and transparent as far as the billing services go. But in this list of services covered under this network, you don't pay for those out of pocket. It's all covered by your monthly fee. So your yearly checkups, they're covered. Your little coughs and colds, they're covered. Your cuts and lacerations and boils and all the urgent care stuff, that's all covered under our plan. So we help patients choose a different health plan altogether to say, hey, I still need insurance for if I get in a car wreck or God forbid I get cancer or something catastrophic. We need that high deductible or emergency plan in place, a contingency. But now we don't have to white knuckle grip our insurance policy for every little nick and hangnail and cough that we get.
yeah, as you try to fulfill your deductible before the cost from the nick and the ingrown toenail, and you're like, man, I got to pay all that just for 5 minutes of sitting in front of the urgent care doctor.
Right.
So it
Exactly.
sounds like a better deal for someone like us, or like me, especially, who has a high deductible and doesn't really go to the doctor.
So exactly, we want to bring quality of care back to the medical community. All of my partners, all of my employees, we all got into medicine because we wanted to help people. And we all felt like the current system was putting a stranglehold on how we could actually help people. Ironically enough, we had to go through more red tape and bureaucracy than just simply treating a patient. So this network helps us, the provider, just as much as it helps you, the patient. I tell my patients now all the time, if you want to come in every day, I'll schedule an hour with you every day, and we can talk about whatever you want. And we can get ahead of things, and we can do labs, and we can do imaging, and we circumvent the system. And, the data is out there. The direct primary care is not necessarily new. It's new to our neck of the woods here in South Louisiana,
Right.
but it's not new overall. But it's gaining in popularity because people want out. People don't want to rely on some bureaucratic insurance system to dictate how their care is going to go. And so that's why we
Right.
come in.
Right. Yeah, I work with a number of older clients, and it seems like the health insurance, then doctors, because of course they want to get paid, and I get the business model of it. But you know what? We're going to need to run this test. Yeah, you're going to need to come back, and we're going to have to go run this test again. You know what? I think I saw T dotted a little bit lower than normal on the last form I filled out. So I'm going to need you to come back in so I can correct that. Meanwhile, ding, 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 right? Your deductibles can hit, you get your co-pay, all these things. And do you really need it? No, maybe, but do you really need an ongoing basis? I don't know. I kind of think not.
That's a great point. And I'm not going to say that all circumstances like that are totally nefarious and unnecessary, because sometimes they're not. But the system is certainly geared to making more and more and more money at the behest of you coming in and paying that copay and paying that. And what really pisses me off so much about it is that there's no transparency, right? You're getting that blood draw at your doctor's office, and you already paid your copay to come in. You have no idea what that cost of that blood draw is going to be until you get the bill in the mail 3 months later. You have no idea.
Correct.
At our facility, we've already contracted all of our prices. So I know exactly what that CBC, for example, is going to cost. It's going to cost you $7 in my clinic. And that's it. And it's done. A chest x-ray is going to be X. Whatever. A CT scan is going to be X. Like, it's not, there's no guesswork. I already know the price. So that's a huge sigh of relief as far as I'm concerned, that I know I'm not going to get some sort of phantom bill 3 months from now.
Oh, absolutely. And that's what we're all going through out there, is getting that bill and saying, holy shit, how is, the $40 Advil, there's always that story about there in the hospital or whatever they give you. I'll just bring my own $2.99 bottle from Dollar General with me next time for the same thing. So I think that's fantastic what you're doing.
I can't tell you how many times I've heard of horror stories just like that, where patients get a $1,400 bill for yearly lab work, or they get charged $300 for a Tylenol in the hospital, or it's really tragic. And our plan is to offer better quality care and circumvent all that stuff.
I think that's great. So tell me a little bit how that can help a business. So you talk to me about how that could help me, Matt Peel, as a patient. But for, say, the company that I work for, the fitness facility that I work for, how can that help them?
Yeah. So there's a number of ways to look at it. Let's say, in your circumstance, let's say the company is already obligated to offer insurance to their employees, right? So I think it's 50 employees, you have to offer some sort of healthcare benefit. So in a situation like this, one of two things is going to happen when you bring us on board. If you cover all of your employees with us, no matter what, they're getting better quality care through us because they don't have to go through the urgent care system or the ER or anything like that. In fact, most of our services can be handled over an encrypted text message that we use via a HIPAA compliant app. So medication refills, and a lot of times even minor coughs and colds and complaints can be handled via telemedicine or text through this app. You never even have to come into the clinic. So it keeps your employees happier and healthier. It acts as an employee retention tool. So instead of, in a lot, let's say restaurants or the service industry, a lot of employees will bounce and hop around for $1 or $2 an hour extra at the new location down the street. Well, now they have to think twice about that because you're offering them a superior level of healthcare that they could otherwise, they'd have to pay out of pocket for, let's say. But my favorite benefit to businesses is the cost savings that we provide. So if a business brings us on and does nothing else to their health insurance, they make no adjustments to what they're already offering their employees, they're going to notice a drop in the premium in the following year because we don't generate insurance claims. So if 80 to 90% of your insurance claims dropped, you didn't make them anymore, your insurance company is going to, number one, they're going to call you and be like, yo, is everything okay? Like, what's going on? Because you're not making the claims. So the following year, you're going to see a reduction. That makes sense? So the biggest impact is when we work with the business to help change that healthcare plan over to some sort of high deductible or catastrophic plan. Maybe it include the health savings account. It's an HSA card where they can put money pre-tax and they can use that at our facilities. That's when businesses really see profound savings and upwards of 40% on something that costs them a lot of money every year, the healthcare benefits.
That's fantastic.
It's really,
it's got to consider that as an option going into maybe the next cycle. So I guess this leads to my next question. So it's July, right, as we record this.
Yep.
So middle of the calendar year, which means elections have already been done last year for now. So can a business just switch this on and off right now, or do they have to wait for the next season per se?
They can switch. Well, they can employ us now and start seeing the benefits of our services immediately. So we're not beholden to any laws or regulations as to, what a business can or cannot bring on, right? So we'd be considered an investment at this point. But the proof is in the pudding. The data is already there. This model has already been proven to save employees money or employers money. So my statement to those businesses is, bring us in, let's have a meeting and we'll show you how we're going to save you money. We're also going to show you how your employees are going to get the best quality healthcare possible because they're circumventing the system.
That's fantastic. I love it. Sounds like a great plan, concierge medicine as a whole. I think it's something that could benefit any company and someone like me who, again, is generally healthy. Don't get sick much. If I do, I'll just get something over the counter. Nothing more than a bumps, scrapes here and now. Sure, I have some catastrophic health insurance if, God willing, something does. I'm unwilling, whatever doesn't, happens, and I need to go to the ER because my leg is snapped off or my head is halfway severed, right? But this sounds definitely fantastic for pretty much anybody, that's out there.
I'll give you a little case study real quick, Matt. We had a patient who couldn't avoid the emergency room, right? They were going to go in, but they contacted us first, and spare all the specifics, but we brought the patient into our clinic and we started an IV, got all their labs done and all their vitals and stuff. And we were able to reduce their level of acuity because we were able to handle a lot of the heavy lifting outside of the system, outside of the emergency room. In addition, our medical directors knew the doctors at the emergency room. So they called them and gave, a peer-to-peer and said, hey, look, doc, this is what we're dealing with. This is what's going to come into your office or to the ER rather. We've already done this. We've already done that. And so the ER can skip all that and they don't have to do it. So we kind of worked the patient up prior to going in, and it was able to save the patient a lot of time and a lot of inconvenience and a lot of costs. And I would say, the quality of care was far and beyond better than what they would have gotten had they just showed up to the emergency room.
Yeah. And they'll fill out the form. If you're not literally dying right there, go sit on the chair and wait.
Right. Exactly. Wait for 6 hours only to get billed $3,000.
Yes. Yes, exactly. Dude, I love it. I love it. So where can people find integrated concierge? You say you have multiple locations. So where can they find those at?
Yeah. Starting on the website, integratedconcierge.com. That's a quick and easy way to get a better understanding of what we do, how we do it, and find all of our locations. You can pick us by provider of our location. And then we're on all the socials as well. Integrated Concierge is our main social handle on Instagram, Facebook. My personal location is Integrated Concierge _COV. That stands for Covington. But you can find us. We share a lot of the same things on both sites.
Nice. Nice. So earlier this year, you wrote your first book.
I did.
Earlier this year or late last year?
I published it just a couple of months ago.
Not too long ago. A couple months ago, The Homemade MD. So what was the Homemade MD? Why did you write it? What was the impetus behind that?
Yeah, the Homemade MD stemmed from my workings in operating rooms and hospital systems, urgent cares. Again, really frustrated with people just simply not knowing what to do, and not knowing very basic navigation of the healthcare system. So, like I said, even with concierge medicine, you can't completely avoid the system, right? If you have some sort of catastrophic injury or cancer or something like that. But you need to know how to navigate the system. So I wrote the book to kind of give them a high level overview of what is a health insurance plan. What's the difference between an emergency room versus a primary care doctor's office, and very high level stuff geared towards people who just are completely medically ignorant, right? Respectfully speaking.
Absolutely.
But
absolutely.
Yeah, I make it fun and easy to read, and it just gives people more knowledge to work the system to their advantage. Called the Homemade MD.
It's like healthcare for dummies type of
healthcare.
deal.
Yeah, you could think of it. Yeah, you could start it that way. Yep, for sure.
So, which is something I think most of us are. If you know the ins and outs of the healthcare system, I think that there's kind of an issue there. You're spending a lot of time in doctors' offices for whatever reason. Maybe you are sick, or maybe you're just someone that wants to use all your dollars up. I don't know, whatever it is. But that's not something that is on the top of our minds every day when I wake up. Man, how can I go to my doctor today and get a referral to do this, and then find out if I got to go do that? I don't think about that. I don't want to think about that. There's a lot of other happier thoughts to have on my brain than how I got to manipulate the healthcare system just to get what I want.
100%. You're absolutely right. And thank God you don't know the ins and outs of the medical system, right? I mean, I think most people don't. Most people shouldn't. But it's a subset of information that you wish you didn't have to know. But when the time comes, that's when my book becomes pertinent and useful, right? Everybody needs to know the difference between an HMO and a PPO, for example, right? Everybody needs to know that you have options when you're going to check out at your pharmacy and how you're going to pay for something. So those are just some of the topics that I talk about.
Oh, I like it. So where can people find the book?
Yep, Amazon. The Homemade MD. I'll have my website up here, seeing thehomemademd.com. But in the meantime, you can search for my name, Arden Ballard, or you can search for you can search for The Homemade MD on Amazon. I'll pop right up.
Right. So that's Arden, ARDEN, and then Ballard is BALLARD. If you're wondering how do I spell this fine gentleman's name.
You got it.
So there you go. Awesome, my friend. Anything else you want to share?
No, man. It's always good. It's always good to catch up to you. I'm appreciate taking the time to chat with me.
Yeah, you're welcome. It's a new venture for you. So I'm excited for you and for everything that got going on. And you've worked hard with Rediscover Aesthetics, and it's nice to see you taking positive step even more to get out there and help more people with your passion. So
yeah, right. This is the evolution, and I'm very excited to just help get in front of more patients and help more people.
Thank you, Arden. Appreciate you joining us today.
Appreciate you, dude. I'll see you later.
All right. Got it. So this is Matt Peel with the Peel Appeal podcast. Check out my website, mattpeel.com. Sign up for my weekly newsletter. You can check out my book, The Athlete in the Game of Life, and also my online programs, Stretch at Your Desk and Strengthen at Your Desk. So remember to subscribe, like, share, tell everyone you know about the Peel Appeal podcast. And until next time, I will see later.
Are you ready to get in the game? Get personal help, sign up for our newsletter, and pick up your copy of Athlete in the Game of Life, the book, all at mattpeel.com. Thanks for listening.